President Akufo-Addo, lodging of the National Health Insurance Levy and the 2.5% of the state contributions to the National Health Insurance Fund has been left to the dictates of the Finance Minister in contravention of Section 52(1) of the National Health Insurance Act 852, which states that, and I quote, "The minister responsible for finance shall within 30 days after collection of the levy cause the levy to be paid directly into the fund and furnish the minister responsible for health and the authority with evidence of payment," unquote. Neither has the minister accounted to Parliament biannually, that is every 6 months, per the law, as expressly required by Section 52(2), which also states that, and I quote, "The minister responsible for finance shall present to Parliament every 6 months a report on payment of levies into the fund." Whilst in opposition, the then flag bearer of the new Patriotic Party, Nana Akufo-Addo, claimed that the National Health Insurance Scheme was dead and that he was coming to revive it. However, his annual payment toward the National Health Insurance Scheme tell a different story. A study of the National Health Insurance Fund allocation formula for 2022 shows that of the 2.056 billion collected from Ghanaians as National Health Insurance Levy in 2021, only 127.4 million Ghana cedis, or 6% of the total collected, was released by this government to address the obligations of the year. It is that not surprising that the providers of services under the scheme, that is the hospitals, pharmacies, laboratories, etc., are often outraged, claiming arrears in reimbursement. This, however, not unique to 2021. In 2020, out of the 2.335 billion Ghanaians paid as National Health Insurance Levy and SNAC contributions for the fund, only 790.29 million, or 31%, was released to address claims for the year 2020. 2019 figures were 721.09 million out of 1.262, or 57%. 2018 figures were 506.80 out of 1.579.9 billion, or 32%. We want to emphasize that since Nana Akufo-Addo took over as president, an average of 41.2% of collections due to the National Health Insurance Scheme has been released, compared to 73.25% under President Mahama. However, how anyone can expect the scheme to pay its providers and have funds to invest is a question only the president, through his finance minister, can answer. Unfortunately, the mismanagement of the National Health Insurance Scheme is affecting the survival of health facilities that offer treatment to National Health Insurance card holders. As of the end of March 2022, service providers were owed over 2.5 billion due to non-payment of claims filed as far back as July 2021. If you consider the fact that we are experiencing a hyperinflationary period with much inflation year on year being reported to have inched closer to 20%, one wonders how service providers who are owed as far back last year are supposed to manage to keep their businesses afloat. Reports by the Ghana Statistical Service established that Consumer Price Inflation Index since January 2020 has changed by some 33%. Tariffs are lagging behind rising inflation, and service providers are denying National Health Insurance card holders services because they cannot sustain their operations at these low rates. Consequently, the low tariffs has led to a situation in which service providers are not ready to offer services to card holders, resulting in significant reduction of claims on the fund. If one compares the 2020 total claims to the 2014, the facts are there. And this is well expressed in the low encounter per active member per year and low average claim per member per year. the scheme is gradually becoming a white elephant. As usual, of the Vice President Bawumia and his stories of lies. His address to Young Elephant TESCON this year included several untruths. He said, among other things, that integration of the National ID card to the National Health Insurance Authority card is being done at no cost to the scheme, and that the scheme is going to benefit from saving made through this integration process. However, the fact remains within the 2022 National Health Insurance Fund allocation formula document that the National Health Insurance Authority is expected to pay 10.6 million Ghana cedis to the National Identification Authority for data integration. So it's not for free. What makes matters even worse is that his lies about the replacement of the National Health Insurance Authority card with Ghana card are also false. This year's allocation provides some 54.6 million for the printing of some 2.6 million National Health Insurance Authority cards at 26 Ghana cedis per one. So it is not true that we are not paying anything because of national ID cards. We cannot continue to lie our way into solving critical national problems. We cannot also continue to ignore flagrant violations of laws enacted to ensure good health care for all Ghanaians. We cannot allow the future of the scheme to be hijacked by Addo and his law-breaking finance minister. The National Health Insurance Scheme is collapsing not because of inadequate funds or inadequate legislation, but purely as a result of poor public financial management of the fund. In concluding, we would like to remind our Bible-quoting finance minister to read what Jesus said in Mark 12:17. Give back to Caesar what's Caesar's, and to God what's God's, and do accordingly. Give funds collected in the name of the National Health Insurance Scheme to the National Health Insurance Scheme, period.